Welcome back. After one Massachusetts mom took her own life just 9 days after giving birth to her twins last month, more health professionals want to help spread awareness about postpartum depression and how and when to seek help. News 10 ABC's Tamara Starr is sitting down live in studio with a member from the EPI's program and a first-time mom to talk about the symptoms and treatments for women today. Tamara.
Thanks, Juliana. Last year, 1 in 10 women in the U.S. has experienced postpartum depression, according to the CDC. Now, more health professionals want to help spread awareness. And I'm here this morning with Kawita Lozon, CEO of the EPIS program, and first-time mom, Lakin Donan. Kawita, Lakin, thank you so much for joining us this morning. I mean, 1 in 10 is a high ratio. Do you believe it's due to the fact that there's lack of resources out there?
Yeah, I think, with postpartum screenings that are being done, Lake and I had even talked about this before, but, you get a postpartum screening at your provider's office, but that's sometimes at 2 weeks or 6 weeks if you had a C-section, and then 6 weeks if you had a vaginal delivery, but it's just not enough. And a lot of times people can just put whatever they want on that screening, and to be able to have resources that like we provide, where we're really able to talk to someone every single week for 4 to 6 weeks right after they have their baby, is essential. So that's why I started this program, because there's not enough resources out there for postpartum moms.
And I know I struggled myself with postpartum depression with my first child, and it was a struggle, just getting treatments for that first year. Lakin, can you talk to us a little about how your journey was?
Yeah, of course. I feel very fortunate. I did not experience postpartum depression, but I know it's a very real thing. But what I can speak to are those ebbs and flows and waves of emotions that you experience during the postpartum season. Just something I would do to check in with myself is just say to myself, okay, I'm having these feelings. Are they within the typical realm of postpartum, or are they getting a little bit more serious, and should I reach out to somebody for help? But that, combined with the program that my job at Davin Healthcare offers to employees for free to work with Nurse Q, when they offered that, I immediately jumped at the opportunity. I thought, what a cool concept, and why not give it a shot to help prepare myself for postpartum. I started working with Nurse Q during the last couple months of my pregnancy, and then during postpartum, she helped us through sleep habits, eating habits, preparing to go back to work, preparing for my husband to go back to work, and daycare. And we can't thank her enough for all she helped us with.
That's amazing. And I mean, for those who are curious about what kind of resources are out there, where can they go?
So one, our resource, of course, that we're helping, but, there's lots of resources out there, but it's hard for people to find when you're already in, survival mode with your baby, and maybe you don't know where to go. I say just go on the state website. You can always go to your provider if you feel like you're having any sort of, postpartum depression signs or anxiety, like call them, even if it's way before or after that 1 or 2 appointments you might have had, call them and get that resource. A lot of hospitals have groups that you can go to. You can also go to state official websites too. NAMI.org is one. That's a really good one too.
Well, thank you both so much for joining us this morning. And if you want to see all those resources and links, you can check them out on our website at news10.com.